what a disaster. India has now ordered its armed forces to help tackle a surge in coronavirus cases across the country, which has been overwhelming hospitals. This comes as several different countries, including Britain, Germany, and the United States, have pledged to send over urgent medical aid. India has a population of 1.3 billion people and has seen over 17 million infections and close to 200,000 deaths. Yesterday saw over 2,800 more people die from COVID-19, although health experts believe that the numbers are probably a lot higher. Well, so many people are dying that bodies are being burnt in makeshift facilities that offer mass cremations. It's really just a horrifying sight. And joining us from New Delhi now is our correspondent Neha Punya. So my first question for you is, what can this rise in cases be attributed to?
Well, there's several reasons for it. Experts say at the start of this year, when cases started falling to record lows, less than 11,000 a day is what India was witnessing somewhere around February and March. That's when almost all lockdown restrictions were done away with. Large gatherings, both religious and political, were being held in different parts of the country, and a sense of normality had returned. Most people weren't wearing masks in public. Social distancing norms were no longer being complied with, and all of this, experts believe, has contributed to this surge. But they also maintain that there is a mutation in the virus that's at play. India has identified a new variant called B1617. They believe it's highly infectious, highly transmissible, and that might be driving these numbers up the way they are.
So what is happening with the vaccination process? I mean, how many people have been vaccinated and with what vaccines?
Well, if you look at absolute numbers, India is doing a lot better than most countries. It's vaccinated about 140 million people so far, but that's just about 10% of the country's population of 1.3 billion people. So the country has a long way to go. It's deployed two vaccines on the ground. One is the AstraZeneca vaccine, which is being bulk produced by the Serum Institute of India, and another is a local candidate. Now, what's happened is that at the start of the vaccination drive, there was considerable hesitancy. The drive was only open to essential and frontline workers, but now as cases are rising, India plans to expand coverage to include all adults starting the 1st of May. But now the problem is of another kind. India is dealing with vaccine shortages. It's exported millions of doses to about 80 countries in the last 2 months, and now its own vaccine stocks are falling short, which is why many centers are having to turn people away.
Are there any regulations that are being put into place to curb the spread of infections? And if so, are people actually following them? Because that's the real issue.
Well, there are no restrictions that cover the entire nation. The government has repeatedly ruled out imposing a full nationwide lockdown like it did last year. Instead, it's encouraged regions to impose limited restrictions depending on how severe the outbreak is in certain areas. For example, here in Delhi, in the national capital, a full lockdown has been extended till next Monday. The government here says it needs that time to ramp up critical medical infrastructure. Maharashtra, which is India's worst hit state, has also imposed quite a strict lockdown, only allowing movement for essential purposes, and many other regions which are now seeing numbers climb back up are imposing similar lockdowns as well, but they're not for long periods, ranging from a week to about 2 weeks.
Now, what is happening in hospitals? How are doctors responding to this influx of patients?
India is a country in crisis because of the kind of strain its medical infrastructure is having to deal with. Many hospitals have run out of beds. They don't have enough medical oxygen supplies. Here in Delhi, for example, many hospitals are turning patients away because they no longer have enough supplies to admit new patients, which is why many people who have COVID-19 are unable to access basic medical care, and experts are saying they're dying even before they can see a doctor or a nurse. And this is a story that's playing out in different parts of the country as well. Delhi has some of the country's best medical infrastructure, but if it's collapsing here, you can only imagine how much worse things might be in interior areas where healthcare services have always been less than adequate.
So what kind of aid has been pledged to India from around the world at this point?
Given how grim the headlines coming out of India have been for a few days now, we have seen an outpouring of global support. Many countries expressing solidarity with India's hour of crisis, saying they will send whatever supplies they can. The US, for example, has dispatched hundreds of oxygenators that India desperately needed. They arrived on Monday. The UK also sending ventilators and oxygenators, which will arrive on Tuesday as well. Many other countries in Asia, Singapore, for example, has sent oxygen supplies. Many in the Middle East pledging help as well. You've got Germany, Russia, and many other countries all promising to do what they can to help India in this hour of need. Now, all of this, when you look at it, as a whole, is just a drop in the ocean, given how massive the crisis in India is. But it's all critical help that experts say could save thousands of lives here.